Erectile dysfunction is the inability to achieve or maintain an erection suitable enough to perform sexual intercourse. Erectile dysfunction is incredibly common. It's probably underrepresented in current population, and it's becoming increasingly more common. Erectile dysfunction can be caused from a multitude of disease processes. Erectile dysfunction can result from treatment for prostate-related diseases such as prostate cancer or an enlargement of the prostate. Erectile dysfunction can also coexist or be caused from certain other medical diseases such as diabetes and hypertension. Patients commonly after coronary artery disease, heart surgery, can also develop significant erectile dysfunction. Erectile dysfunction is commonly diagnosed through a proper history and physical exam. We often hand out an inventory score sheet called Sexual Health Inventory for Men, which helps give us a numerical score to apply to some of the symptoms associated with erectile dysfunction. Erectile dysfunction can be prevented in some patients in certain surgeries that are performed for prostate cancer or prostate-related diseases. Certain nerve-sparing techniques can be applied in certain individuals to help prevent some erectile dysfunction. Not smoking and quitting smoking, avoiding the use of illegal drugs, and controlling or preventing diabetes and hypertension will go a long way at preventing erectile dysfunction. Benefits of seeing a specialist for erectile dysfunction are proper diagnosis, whether or not it's an organic cause or a non-organic cause to the erectile dysfunction. They also can provide the complete range of treatment options from minimally invasive to more invasive approaches that are only offered by a specialist. In addition, certain laboratory tests and others can be checked to ensure that those are also functioning normally, and if needed, further referrals for possibly underlying vascular disease or heart disease and diabetes can be made. Treatment options for erectile dysfunction range from behavioral modification and lifestyle changes such as stop smoking, limiting alcohol, increasing exercise, weight loss, control of diabetes and high blood pressure. In addition to those, oral medications can be given to help with erectile dysfunction. In addition to oral medication, there are vacuum devices that actually create a negative pressure and create an erection through a vacuum suction, and rings that help go at the base of the penis called veno-occlusive rings to help decrease the outflow of blood. Injectable medications can be an option, and these are medications that are injected directly into the penis. There are some suppositories that can go down the urethra to be used, and penile prosthesis or penile implants are an option that can be implanted beneath the skin to provide treatment for erectile dysfunction. The correct treatment option for each man depends on a multitude of factors. It's a joint decision involving the patient, the partner, and the physician. Each patient's specific situation is weighed. The degree of the patient's erectile dysfunction or impotence is factored in. Economic factors can also be factored in. Patients' biases. Some patients are scared of needles, and injectable medication would not be an option. Some medication is incredibly expensive, and so economically that might not be an option. Very commonly, men don't respond to oral medications. Commonly, men want to try to be restored to a spontaneous, less planned erectile function, and lots of times penile implants or penile prosthesis can provide that. So each man in each scenario is taken into consideration, and all the options are weighed with the patient's preference. Success and satisfaction rates of some of the various treatments for erectile dysfunction. It is quite high with oral medication. However, not everybody is going to respond to oral medication. Unfortunately, diabetics can be poor responders to oral medications. Some patients can't take oral medication given other medicines that they do take that interact. Some patients have negative side effects that preclude treatment of oral medications. Medications have become, as they've been generic, somewhat more affordable, and overall, for mild erectile dysfunction, oral medications have a high satisfaction rate. Vacuum erection devices and veno-occlusive rings have overall medium to poor satisfaction rate. They can be quite cumbersome. The rings can make the penis numb. It blocks the ejaculation. Sometimes it can inhibit climax. It can make the penis feel cold. They're quite cumbersome. They're not very spontaneous. They're hard to use with a partner you're not comfortable with. So the satisfaction rate for vacuum erection devices is quite low. Injectable medications have a modest satisfaction rate. Some patients have a phobia of needles or have some physical impairment, which precludes them from being able to actually give themselves the injection. And so if you can't give the injection or you're scared to give the injection, that makes the satisfaction quite low. Satisfaction also is inhibited by the fact that a lot of the medications can't travel very well. They have to stay cold. Some of the ones that can be temperature stable or cost prohibitive, patients really have trouble affording those on a per dose basis. There's also limitations to the frequency of use with those. Some thoughts are also if you have problems with penile curvature or a disease called Peyronie's disease, that penile injections could actually make that worse. Suppositories in the urethra actually have a pretty low satisfaction rate in that they can create a lot of burning and stinging. Though they do work better than some of the oral medications, they're probably the most expensive treatment option. And so overall, not a lot of my patients undergo urethral suppositories for the treatments. Actually, the highest patient and partner satisfaction rate is probably with penile prosthesis plating. Data has shown that patient-partner satisfaction for penile implants is over 90%. A lot of that probably is the fact that there are no limitations to the frequency of use. There's no duration where it can only be used. There's really no limitations. There's a lot more spontaneity involved in a penile prosthesis or a penile implant. And for patients that want to be sexually active, don't want to be restricted by a certain geography as far as their medication traveling, they don't want to be limited to the frequency of use, the duration of use. They want to have absolute confidence in that. Penile prosthesis has an incredibly high satisfaction rate when all those things are taken into account. Some of the long-term consequences of impotence and not being able to have an erection are, number one, psychological. A lot of men really struggle with the psychological component of not being able to get an erection and possibly perform sexual intercourse. I find in a lot of my patients that even if they don't have an active partner, they're negatively impacted with this sheer thought that if they got into a relationship that they might not be able to perform, or it might cost them a relationship in the future because of their impotence. Some patients are negatively impacted psychologically with their current partner that they have. The partner oftentimes thinks that it has something to do with them, when in fact the patient has a medical disease process that's limiting that, and it's not their choice, but the partner perceives that as being something wrong with them, and so it can actually disrupt relationships. On an organic, physical aspect, not just psychological or psychosocial aspect, but not obtaining an erection for a prolonged period of time can actually lead to penile atrophy and fibrosis. And this can cause penile shortening, and if the penis does not stretch and expand and get healthy blood flow, it actually can cause the penis to retract. Sometimes in patients, especially if they're dealing with weight issues and other things, that can make even just urination, hygiene issues problematic. So not having an erection can affect physical, emotional, and social issues.